Okay, good morning once again. Welcome to Health Matta. Today will be Saturday, and as it be Saturday, you know what they take and do? They take and talk about things we get to do with our health, that is health-related issues. My name is never change, I'm still Chief Olododo, and on the show with me is Dr. Bats, the CEO, Grace Valley Medical Center. You don't take us through the journey of COVID-19, and most definitely, that's where we'll continue from. Good morning, sir.
Yeah, Chief, good morning, sir.
Well done, sir.
I'm pleased to be back. Good morning, viewers at home and around the world. I welcome you all to today's episode of Health Matter on WAP TV. Today we'll be continuing with a topic we started some few months ago, coronavirus pandemic. We'll be looking at this coronavirus pandemic on a number of subheadings. Number one, we are going to do a recap of some of the things we have said before about this contagion, about this disease. We're going to do a definition. We're going to talk about signs and symptoms. We're going to remind ourselves of the means/routes of transmission, as well as the global picture. What do we have in Africa? What is the affectation at the moment in Nigeria? Okay, so we're going to look at all of that, as well as measures of containment that have been put in place to contain or to interrupt the further spread of this deadly pandemic. And if we have all the time, we'll go as far as talking about measures that have been put in place. Number one is how to correctly use the face mask alongside other measures of prevention. Coronavirus, as we have said a couple of times before now, is actually a large family of viruses from the family Coronaviridae. A good number of them actually affect animals predominantly, but a few affect humans. Now, talking about the ones that can affect humans, a good number of them will cause little or no symptoms. Some will cause the common cold that you and I know, and that will just be it. But a good number of them, a few of them actually, have actually caused severe disease in humans. And those ones that have caused severe disease in humans are notably, number one, SARS that emanated from China sometime in 2002-2003, severe acute respiratory syndrome. And after that, the world also saw another type of coronavirus that emanated from Arabian Peninsula, talking about MERS, Middle East Respiratory Syndrome, which of course, like the SARS that occurred in 2002, killed a number of people. But the fatalities are not the same with what we are seeing today with the new coronavirus, officially named COVID-19. What are the signs and symptoms of COVID-19? What is the causative organism? Coronavirus is a viral infection. It is a disease that is caused by virus. A number of viral infections could be self-limiting. I also want to point out that a good number of people, large percentage of people that may be affected by this contagion, about 80%, some authorities say 80 to 85% of people that may be affected, may not actually present with significant symptoms. They may present with no symptoms at all or with just mild symptoms. With or without treatment or therapy or hospitalization, this group of people will recover over a period of time. And this brings us to the incubation period. The mean incubation period of COVID-19 is said to be between 5 and 6 days. What do we mean by incubation period? The time of getting infected to the time that the symptoms begin to show up. That is what incubation period is all about. But it could be in the neighborhood of 1 to 14 days. And as a result of that, most of the people who are kept in quarantine, be it mandatory quarantine or otherwise, are usually kept for a period of 14 days. For individuals who are exposed, who are told to isolate, it is usually for a period of 14 days, within which time the symptoms may begin to appear. Suffice also to say that it is not only people who are symptomatic that can transmit this problem. A number of people who are asymptomatic, who are showing no symptoms, can equally transmit this problem from one individual to another. There are also what we refer to as pre-symptomatic carriers, people who could be infected, and within that short period of time that they may not be presenting with symptoms, they are equally as contagious as people who are presenting with symptoms. So this group of individuals can equally still infect people around them. What are the signs and symptoms of this COVID-19? The major signs and symptoms of COVID-19 are said to be 3 of them. Number 1, people who are infected who are presenting with symptoms could present with dry cough, could present with high fever, could present with breathing difficulties or shortness of breath. There are other symptoms that are beyond what have been shown to us on the screen. Other symptoms like loss of smell, loss of taste, diarrhea, passage of watery stool, sore throat, and in some cases, some other neurological symptoms. A good percentage of critically affected individuals were found to have even strokes. Okay, so it is not just limited to the 3 major symptoms that we talked about. What are the means or routes of transmission? It is a highly contagious infection or disease entity that we have said before. The routes of transmission are usually through droplets that can be pushed out when we cough, when we sneeze, when infected humans, infected people cough or sneeze, or even talk strongly. It's embedded in the droplets that we produce in the course of doing all these things. And of course, they could be aerosolized in the sense that it could become like air. And some of them that are said to be heavy will drop within minutes or within few seconds. And a good number of them could hang in the atmosphere for a much longer period of time, especially when this is happening in an enclosed environment where you do not have the benefit of having air currents around you, where you do not have proper ventilation. The windows are not open as they should be, especially in the air-conditioned environment. That is the reason why we are today being asked to go with mask anytime we are in the public, to go with face mask, to mask up Nigeria, to mask up Lagos. Okay. Now, the global affectation at the moment, the number of people that have been affected globally, it has affected over 4.5 million people. Specifically, 4,628,821 individuals have been affected globally. And it has caused fatalities, deaths, up to 308,654 people have unfortunately lost their lives to this contagion. Suffice also to say that quite a large number of people have equally recovered. 1,759,701 individuals have recovered from this contagion. Let's talk about the country that is worst affected at the moment and give an idea of the number of fatalities, the number of daily cases that these countries are seeing as we speak. Of course, we all know that US is on top of such a list. Total number of cases affected in the US at the moment is 1,484,285 persons. they had a daily new cases of 26,692, and the number of individuals that have died to this scourge, to this medical condition and other related comorbidities, at the moment in the US stands at 88,507. That's massive for just one country. And of course, after US is Spain, 274,367 persons have been affected. And as of the last 24 hours, Spain witnessed 1,721 new cases. And it has killed 27,459 individuals in that country. Russia has actually jumped to third with 262,843 individuals affected at the moment. Their daily new case was 10,598. Surprisingly too, with this degree of affectation for Russia, only 2,418 people have died in Russia. And that must be probably, it may have something to do with their healthcare system. Okay? Now, after Russia comes UK with 236,711 people affected. Their new case was 3,560. And of course, total deaths that happened in the UK at the moment was 33,998. And after UK comes Italy with 223,885. And then the number of new cases in Italy has actually dropped significantly to 789 in just one day. And that brings the total number of deaths in Italy to 31,610. Now, I want to point out something from these figures that I read out shortly. In the whole of Europe, the numbers are beginning to drop. And that is the reason why a number of countries that instituted lockdown, that locked down their cities, are beginning to ease off the lockdown because of the figures they are getting. But it is not so for Russia. It is not yet so for US and a number of other countries. Now, coming nearer home to Africa, at the moment, South Africa tops the chart with 13,524 individuals affected in South Africa. Their daily new case in the last 24 hours was 785. And that brings the total number of people who have died to 247. Egypt is second in Africa with 11,228 cases. Their new cases as of the last 24 hours was 399, and the total number of people who have died in Egypt is 592. Morocco comes third with 6,652 people affected. New cases in Morocco was 45, and total number of deaths 190. And after Morocco is Algeria, 6,629 cases, 187 new cases, total deaths 536. After that, Ghana, 5,638 new cases, 108. Total number of deaths in Ghana, 28. That speaks volume also about their healthcare system. Nigeria comes sixth with 5,450 individuals. Overnight, we saw 288 cases in Nigeria, with a total number of people who have died in our beloved country, now 171. There is no doubt there is so much that we need to do to mitigate against, to interrupt further spread of this infection in Nigeria. And today we are going to talk about some of those things. Talking about containment measures. Last week, I reminded us of the projection that was made by WHO that said in the next 1 year, beginning from the time the infection actually started in Africa, that we may see as high as 250 million Africans affected. And we could have as high as 190,000 people dying to this scourge. And we don't pray to get there. Now, some of the containment measures, the essentials of containment, that is if our containment measures fails Of course, they pointed that out. The essentials of the containment measures is number 1, you need to test. Number 2, you need to trace. When you test and you get number of positive cases, you need to do contact tracing. You need to look at the people those individuals have come across. And after that, you need to isolate them. And of course, treatment. The area of isolation is actually where we are not getting it right at the moment. And I will tell you my reasons.
Okay. Maybe we would actually owe that a bit, sir, because most definitely we still have the luxury of time for you to further dissect the issue on COVID-19. While you take a pause, we'll go on this skinny break. Most definitely, Health Matter. We'll be right back. Go nowhere, please.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show wey dey help people. Terms and conditions apply sha o.
Wet your hands with water. Apply soap. Rub your hands palm to palm and wash the backs of both hands and in between your fingers. Then palm to palm with fingers interlocked. Clasp your hands together and rub. And then clean around the thumbs too. Rub your fingertips in the palms of your hands and finish off with the wrists. Rinse your hands really well with water and dry them thoroughly with a paper towel. Use the towel to turn off the tap. Your hands are now clean.
Okay, you welcome back to the show Health Matter. You know, when we don't reach this segment, that is the second half. As first half don't go. Now, where would they take open the phone line so that when I say where they ask go fit chook mouth, ask question. Dr. Bat, they here gidigba. Bangba on top anything where they do your mind yaga yaga. No be only that too. Even our MCR go help us put in details up so that anyone will be say you dey feel shy, you know, if you ask on top television, you still feel call am for back. Say, okay, doctor, see as they do me true, then he go guide you most definitely. Dr. Bat, let me take the first shot. We know it's the question segment now, so let me quickly take the first shot, sir. And the first shot is over the news for the past 1 week, we've heard about the poisons, the strength, the efficacy of the Madagascar drug vis-a-vis our own local herbs. If truly the poisons of Madagascar herbs works over there, what stops it here? If truly the efficacy is internationally acknowledged, why are we not using it here? Or is there any international medical law that forbids it, sir? That's number one.
Okay, thank you very much for that question. It keeps popping up all the time. Now, I must start by saying kudos to Madagascar as a country. Of course, it was a good effort they made, okay? But whether or not that effort will give the desired results is still to be determined, okay? That will be my opening statement. In the sense that WHO has come out to say that the efficacy of the Madagascar supplement or herbal mixture, if you like, which of course to me is similar to some of the herbal mixtures we have in this environment, though it was named COVID Organics. The WHO has come out to say that the efficacy is still undetermined. And of course, I said before now that the president of Madagascar actually said that it cured 2 people, and that is hardly enough number when you're talking about scientific validation of a drug.
Cured just 2.
Yes, according to their president, according to the Madagascar president. And a good number of people actually say that at the moment that there's no new cases at Madagascar. It is also not true. Last week, prior to the program, I think they had about 16. Overnight, in the last 24 hours, they had about 8. And there could be a number of factors, too, that can actually be responsible for the degree of affectation that a country can have. Now, but coming to the Madagascar drug properly is actually a topic I followed with so much enthusiasm because, of course, as a person, I want to see the solution come out from Africa. That will be something we'll all be proud of.
And Madagascar is East Africa, so we are...
Yes. Now, I also listened to the SGF, Mr. Boss Mustafa, recently talking about the Madagascar consignment that Nigeria was expected to pick up. Now, what he has to say is this, that Nigeria never solicited for Madagascar drug or supplement. That Madagascar, out of their own magnanimity, decided to distribute to a number of African countries with the view of showing brotherly love to these African countries that are affected. He actually said that Nigeria's consignment, they actually deposited all of the ones that they've shifted, that they wanted to give to some African countries. They dropped it in Guinea and asked other countries, the affected countries, to actually make arrangement to pick up their own consignment. So not that Nigeria as a country actually went for this drug. Now, that said, he also pointed out that similar to what is currently ongoing in Nigeria, when the drug reaches the shores of Nigeria, it will be subjected to clinical analysis. Evaluation, thank you very much, by relevant government agencies. They're not bringing it to put it on the shelves of pharmacy shops so that people can access it. Okay? I'm also happy because I also read that WHO at the moment is trying to interface with a number of locally made herbs, the producers of some locally made herbs. So it's not we're in a stage where WHO is looking at all sides to this equation. They're not just narrowing their vision to the Western-made therapeutics only. They're also looking inwards. Okay, so whether the drug cures or not, when you talk about drug or supplement, you need to talk about drug on a number of topics. Number one, the potency. You need to talk about the efficacy. You also need to talk about the safety index. You also need to talk about the compound, the content of such a drug. So there are still a whole lot to be done. I do know that one of the major components that COVID organics contain is a plant that is known as Artemisia annua. It's a major... No, it's not the Gonyaro. Artemisia annua. I'm not sure it's found in Nigeria. It's a Chinese herb that actually form the bedrock of artemisinin drugs, artemisinin-based drugs. It's actually a Chinese herb. Okay? Artemisia annua, I understand, is one of the major ingredients of that. It's a form of anti-malaria agent. Okay, so whether this drug will be as efficacious as presented to us in this part of the world, we will find out shortly.
Okay, that is Dr. Batt's details on the screen. Feel free, copy the number. If you want to ask him private questions, yes, Dr. Batt will be magnanimous enough to pick your calls and you can WhatsApp him.
Thank you, Dr. Batt,
the very next thing I would like to ask, Doctor, is the issue of test kit. A lot of Nigerians want to actually go through the test. Yes, while some are actually scared, but I must tell you, even going from online investigation, we see that a lot of Nigerians want to actually go through this test. Sir, you as a medical doctor, can you give us just a range of how much it costs to get oneself tested And as an average Nigerian, if I want to do the test now, should I come straight to your hospital, sir?
Thank you very much. I'll take that as a joke, sir.
Yes, sir. Yes, sir. Yes, sir.
Okay, yeah. I must start by commending the authorities concerned. NCDC, the Presidential Task Force on COVID-19, they've done wonderfully well in areas of testing. I was among the early people who were bashing them left, right, and center because at that time we felt we weren't doing enough in terms of testing. Okay, but that said, at the moment they have about 25 laboratories, molecular laboratories that have the capacity to test for COVID-19 in Nigeria. I think the last one that was activated was in Adamawa. They've also interfaced with the private sector. Okay, one was recently, a private lab was recently activated in the southeastern part of Nigeria, specifically Imo State. Okay, they have one now, so they are beginning to incorporate private partners into the testing arrangement. And of course, we stand to benefit as a country. I have one of the tablets, the statistics that will be shown to us in a matter of minutes now, that have the actual number of people who have been so far tested in Nigeria. It will be shown in a little while.
Good one.
Okay, so Nigeria has gone beyond 30,000.
Wow.
But we haven't tested up to 35,000 as we speak. Also, if you look at the number of, okay, we have it now. Okay, so that's the number, that's the updated list. The number of people so far tested, 30,657. That should be as early hours of today. And of course, with that, we've been able to discover 5,405 infected individuals. Now, if this number is anything to go by, if these records are anything to go by, it stands to reason that if we're able to test more, we actually should be able to pick more. Sure. If Nigeria is testing as much as South Africa has done, I'm not sure Nigeria will still be below South Africa at this time. And I will tell you my reasons. I talked about some of the failures of containment measures that we are currently having in Nigeria. One of them that I want to point out is the fact that some state governments who probably felt they were doing it in the interest of everybody, that ended up repatriating child beggars to their home countries. It turned out, that move has actually turned out to be counterproductive. As against several warnings that the SGF was given always, that state government should actually not repatriate anybody, that at the moment borders are shut. But a number of states went ahead to do that. They had child beggars crammed up in vehicles, apparently having infected and uninfected people, unknowingly though, in the same vehicle. A particular state, for instance, said they repatriated about 30,000. A state in the north said they repatriated about 30,000 child beggars to their home country. And it turned out to be that these child beggars, a good number of them have tested positive to COVID. And these are children that are roaming the streets without any place, any roof over their heads. So you can imagine what will be happening now at the moment if this set of group of individuals are not isolated promptly. They will keep distributing and infecting all the people around them because they thrive on begging for their livelihoods. So it turned out to be that that move was not a good one eventually. Suffice to say that some of the states that actually did it may have done it in good faith. Okay? So one of the things we need to do as a country is to make efforts. I don't know how that is going to be possible. Okay. I have something in mind when I was thinking about this. Can some governments use pre-existing dormitories, now that schools are no longer on, to house this group of individuals, child beggars, so that they can easily isolate the infected ones from uninfected ones, and then see how they can be managed? All of this will help us to mitigate against further spread or interrupt the community transmission that is actively ongoing. Also in Lagos State, I can tell you that the number of infected active cases in Lagos are by far beyond the available isolation-based spaces, without any doubt.
Sure.
So measures are in place, I know. Efforts are ongoing, I know, by Lagos State government to ensure that these individuals are promptly isolated. Until we're able to do that, we may not stop seeing the exponential rise in the number of cases that we are currently seeing on our figures. Suffice to also say that we haven't yet gotten to the peak of this pandemic in our country.
Mr. Joshua, good morning, Joshua.
Good morning.
You're welcome to the show, sir.
Thank you very much, sir.
Please go ahead. The doctor is here.
Okay, sir. Doctor.
Good morning, my brother.
Well done, sir.
Yeah, thank you very much.
Very well, sir. How is everything, sir?
We are good.
So my question is, this coronavirus of it, the cure that they got from Madagascar, how true is it? Because in Nigeria here, the number of deaths is increasing. Total number of affected people is increasing. And we need to get the cure very fast before all of us die off the surface of the earth. Because if it continues this way, before 2021, Nigeria would have died everybody.
Okay, thank you very much, Joshua.
Thank you very much. We pray we won't get there, sir.
Thank you.
Yeah, we said shortly a while ago that the Madagascar organics, that the efficacy of that supplement or herbal mixture is still undetermined, is not yet proven. Okay? Now that he has actually talked about that, let me also chip in this at this point. We all know, and we have spoken a lot about the ongoing WHO-sponsored solidarity drug trial that is ongoing. That, of course, Nigeria
has been picked.
Yes,
Or
Nigeria.
We volunteer ourselves.
Yes, we volunteered to be part of it. Over 100 countries of the world are currently participating in that study. About 5 states in Nigeria have shown interest to be part of that study. Now, the early reports that are coming out among the 4 drugs that are being tested, okay, recall that not too long ago, the American president talked about the use of chloroquine and hydroxychloroquine. Okay. Early reports that are coming out from some of these countries that are participating in the drug trial have actually shown that chloroquine or hydroxychloroquine have no positive effect on COVID-19.
Wow.
That has no, but it's still too early to conclude. On that same note, a drug that was developed some 4 years ago for the treatment of Ebola, remdesivir, yes, is said to be doing very well with ongoing trials. That's just to chip in one thing, to chip in something along that line.
Okay, Dr. Bat, I'll hold you a bit. Yes, I want to go to the next question, but before that, sir, the range, I don't know if you have an idea of what it costs to actually test for COVID-19.
For now in Nigeria, COVID-19, the cost of doing COVID-19 tests is solely borne by the government. Okay, but I don't think I have an idea of what the arrangement will be now that we're having private participants coming in. Okay, because...
Okay, the very next one I'd like to ask, sir, the issue of SARS, MERS, Ebola, most of these viral diseases, I stand to be corrected, sir, and I want you to correct me if I'm wrong. I want to believe we did not actually get to a point where we said, this is a vaccine. There's a vaccine for them that later cured it. I guess they all frizzled out with time. Are we expecting to see same for COVID-19 too, or we actually had vaccine for the likes of SARS, MERS, and Ebola? If you ask me, I felt the frizzle out with time, and if care is not taken, maybe that's what will happen with COVID-19 too.
Thank you very much. And of a truth, I must point out that getting a vaccine or getting a drug takes several years. It takes several years. Remdesivir, that we talked about shortly, developed 4 years ago, took a lot of time.
Sorry. Obayi, good morning.
Hello, good morning.
Good morning,
good
sir.
Good morning, Obayi.
Yes, I want to speak to Dr. Bat.
Yes, go ahead, sir.
My question goes like this. Good morning, Dr. Bat.
Good morning, my brother.
Yes. I said concerning this COVID-19, there are people who
don't believe that it exists. I just want you to throw more light on it to educate them.
Thank you very much. Thank you very much. we keep getting this question. Now, I don't know at this time why people should still be doubting the existence of COVID-19 in Nigeria, because we do know and we have heard of very reputable or very well-known Nigerians that graciously have survived this scourge.
And some whom have died too.
And a number of them who have died too. But let's restrict ourselves to the ones that survived. Chief Raymond Dokbesi, the owner of AIT and
Dar Communication.
Yes, and Ray Power Radio, has recently come out to say that he was stricken alongside other family members. Also, Raymond Dokbesi Jr. too was equally infected but now cured.
They
the
all
father
returned.
has been cured. The son has equally been cured. And of course, we have said before, our one-time Vice President Atiku Abubakar, his own son too was stricken at a time but has now been cured. These are reputable Nigerians. These are known people that a good number of us out there will know. I do know that what people want to see are some pictorial evidence.
If not video, visual.
Yes, that can actually help people to appreciate the enormity of the challenges we have on our hands. And I also believe that government can actually do that without infringing on people's rights.
Right. Yeah.
Okay? If you show a doctor or some health workers in their full PPE, it's not going to show any doctor's face. You hardly can identify anybody. And if you show a patient who probably is covered on a couch, the face may also not be shown. So Nigerians want to see pictorial evidences to appreciate that these things are with us. They don't just want to look at those figures that we are seeing. So I think a government may still need to tinker the present arrangement in such a way that, because the essence is to enable every Tom, Dick and Harry on our streets to appreciate that we have a challenge on our hands. And it is everybody's business to ensure that this problem is stopped before he kills all of us, like that man said.
You were actually talking about men's SARS vis-a-vis vaccine and...
Yes, I said it takes a long time to have a vaccine produced. It takes a long time to have a drug produced. I will also talk briefly on the Solidarity drug trial that is ongoing. The drugs that are being tried under Solidarity are about 4 drugs. They were not newly produced drugs. They were pre-existing drugs.
Okay.
Chloroquine, hydroxychloroquine, they've been there for ages.
Remdesivir
4 years ago. Okay? And a number of other HIV drugs, antiretroviral drugs that are equally undergoing trial at the moment. So it takes years to produce a vaccine. As I've said before now, the recent update we had along that line showed that about 89 vaccine candidates were in different stages of research and development. And about 7 of those vaccines have actually gone to a step higher than others, a step of clinical evaluation. We are looking at least the American president has actually said that at the beginning of next year, we may begin to see vaccines that are ready for use. Okay? And WHO Director General said work are ongoing at breakneck speed to ensure that we get vaccines and get drugs that can easily be used to tackle this problem.
And we so pray that we will be able to tackle and overcome. Most definitely, we are not done on this theme of discussion, that is COVID-19. So therefore, next week, we're going to continue with Dr. Bat. But before we go, say thank you very much.
Thank you very much. Next week, we are going to dwell on the right way to use the face mask.
Okay.
Thank you.
Thank you.